Welcome back to Toledo Clinic TV. Our guest for this segment is Caroline Humberston. She's a physical therapist, and something I think we all can relate to is back pain. At some point in our lives, we will injure our backs. It's common that we will injure our backs.
Yes.
So you specialize in knowing exactly where the injury is. Explain that.
Yes, we have what we call a classification system and an understanding of how the different body parts relate to one another. So for example, most disc injuries happen from a bending over type of situation, whether it's a repeated bending or you just bent one hefty time. That's a lot of times where a lumbar disc injury will occur. So we will identify how to fix that. Generally, it's by going the opposite and bending in the opposite direction, trying to correct the problem. Other things that may influence the back is a tight hip in the back of the hip. If the hip is so tight that when you go to bend over, the hip won't let you to do that, then the lumbar spine actually compensates, bends too much, and can create a disc problem. The other thing that can happen is if you don't have enough abdominal strength. Your back doesn't have the support that it needs in order to bend over properly and return to stand with the object that you're lifting, or just simply returning to stand.
So are many of those injuries you see because of repetitive problems, or something that someone has just done one time and they've caused an injury?
It can be both, actually. It really can. Repetitive injuries are more common simply because they're micro traumas that occur over time that you don't really even know happen. They're just little micro traumas. You end up with a sore back and you think, oh, it's no big deal, it's just a sore back. And then that sore back becomes a bigger area of soreness, and now all of a sudden you have pain going down your leg, and then it's a problem. So we see everything from acute problems to just happening to the repetitive injuries.
How difficult is it for you when you have a patient come in to really determine where the exact source of the problem is?
The source of the problem isn't always where the pain is. That's the confusing part, and that's the difficult in trying to explain that to the patient. If you have a sore back, for example, and you have tight hips, it's really hard for a patient to understand that we need to stretch the hips out without moving the back. So a lot of my day is teaching a patient how to do exactly that, how to move their hips without moving their back, and isolating those movements, strengthening their abdominals without pulling in their hip flexors, for example. It's really hard to isolate those movements and learn how to differentiate them.
I think so many of these things are activities and exercises that we do in our daily lives, and how do we know that we're doing them wrong?
Generally, they hurt if you do them wrong. So if you do it wrong and you kind of naturally move to a different way so that it doesn't hurt, and then still eventually will hurt. It's kind of like a car that's got an alignment issue. If the car is driving out of alignment for a while, it can survive okay, but after a while, the tires start to wear unequally, and then you end up with having to get new tires. So our bodies are the same way. They're magic machines that can compensate for movement faults. However, if you do them the same way over and over again, you end up destroying tissues of some sort.
So how does a person know that they need to seek help from a physical therapist?
Generally, if that's something that's been bothering you for more than a couple of weeks and doesn't seem to go away with general stretching, resting, over-the-counter icing, ibuprofen, things like that, it's time to see a physical therapist to figure out what you're doing wrong and how you're moving incorrectly.
Okay, and then you can teach them how to do things correctly so that that doesn't happen again.
Exactly.
Okay, all right, thank you very much.
Thank you.
We will be right back.